You ever look at a tiny vial of a vaccine and just wonder, what does it really take to get it perfect? Well, it's not just about the incredible science inside the vial. Turns out there's this hidden world of rules and records, all on paper, that make sure every single dose is safe. Let's get into it.
I mean, just stop and think about that number for a second. Billions of doses. Not millions, billions. And they have to be sent all over the world. How on earth do you make every single one a perfect, identical copy of the last? It's honestly one of the biggest manufacturing puzzles on the entire planet.
And the answer, well, it requires a complete shift in how you think. You can't just make a huge batch of something and then test it at the end to see if it's okay. By then, it's way too late. The real secret is to build that quality in right from the start at every single step of the journey.
So here's our game plan. We're going to start with that huge challenge. Then we'll look at the system built to solve it. It's called GMP. After that, we'll get into the real heart of it, the key documents, especially SOPs and the master formula. And finally, we'll tie it all together to see how all this paperwork, believe it or not, literally saves lives.
All right, let's just really sit with the scale of this challenge. We're talking about making billions of doses that have to be identical. Even the smallest, tiniest change could have massive consequences. You need a system that is absolutely rock solid.
And that system has a name. Good Manufacturing Practices, or GMP for short. The World Health Organization basically defines it as the part of quality control that makes sure products are consistently made the right way. That word, consistency, that's the magic word in all of this.
You know, this really is a huge leap in thinking. The old way of doing things was reactive. You'd make the stuff, check it at the end, and just kind of hope you caught any mistakes. But the GMP approach? It's completely proactive. It's all about controlling the whole process to stop mistakes from ever even happening.
So, how do you control every single little step? What's the tool for that? The answer, and this is the absolute engine that drives GMP, is meticulous, detailed, some would say obsessive documentation.
This quote really gets right to the heart of it. The paperwork isn't just a boring record of what happened, it is the quality guarantee. It's the physical proof that the product was made exactly right. In this world, there's a simple, unbreakable rule. If you didn't write it down, it didn't happen. Period. So GMP documentation basically stands on four main pillars. First, you've got the instructions. These tell people exactly what to do. Then you have the records, which prove that they actually did it. You also have unique identification numbers to track every single thing. And finally, you have labels to show the status of everything at a glance. Is it ready to go, waiting for testing, or rejected?
Okay, so let's dig into this a little deeper, starting with the first of our hero documents, the SOP, which stands for Standard Operating Procedure.
An SOP is pretty much the official rulebook for any single repeatable task. And I mean any task. How to properly clean a piece of equipment? There's an SOP for that. How to calibrate a thermometer? SOP. How to log into a computer system? Yep, there's probably an SOP for that too. A really good SOP leaves absolutely nothing to chance. It's designed to answer every single question someone might have before they even think to ask it. Why are we doing this? Who is supposed to do it? What tools do I need? And most critical of all, it gives you the precise step-by-step instructions on exactly how to do it. And here is a perfect, simple example of that proof in action. See, an SOP for an incubator doesn't just say, hey, keep this thing at 37 degrees Celsius. No way. It requires a log, a physical record where every single day an operator has to check the temperature and sign their initials. This simple form becomes hard, legal evidence that a critical piece of equipment was working perfectly. Okay, so if an SOP is the rule for just one task, what pulls it all together? What governs the entire production of one whole batch of a vaccine from start to finish? Well, that's where our second hero document comes in, the master formula.
I think the easiest way to get your head around the difference is this cake analogy. An SOP, that's like a detailed recipe for just the frosting. Super important, but it's only one piece. The master formula? That's the master blueprint for the entire three-tier wedding cake. It orchestrates how all the different little recipes and steps and procedures come together to create the final product.
And I mean it orchestrates everything. The master formula is this massive, multi-part document that lays out every major stage of production, from growing the initial cells to purifying the active ingredient to mixing the final formula, all the way through filling thousands of tiny vials and getting them packaged up. It's all in there.
And this is where it really comes to life. The master formula starts out as a blank template, right? But as a batch moves through production, operators fill in every single detail. every measurement, every temperature, every signature. This living document transforms into what's called the batch processing record. It becomes the complete biography, the entire life story of that one specific batch.
Okay, so we've looked at the documents, and yes, it is a lot of paperwork. But let's bring this all home. Why does any of this really matter? How does a mountain of paper actually end up saving lives?
Well, it really boils down to three incredibly powerful things. First is consistency. This system means the vaccine you get in New York is the exact same as the one someone gets in New Delhi. Second, traceability. If a problem is ever found, officials can go straight to that batch processing record and trace the issue back to the exact machine, the exact day, the exact person, and finally, assurance. This is the confidence we can all have, knowing that quality wasn't an accident, it was designed, documented, and proven every single step of the way.
So when you see that simple, clean vial of medicine, remember this. Supporting it is this huge, invisible scaffolding built from thousands and thousands of pages of meticulous paperwork. It's not just bureaucracy for the sake of it. It is the very structure that makes modern medicine trustworthy and reliable. So I'll leave you with a final thought. The next time you see a vial of medicine, any medicine, will you think about that invisible mountain of paper standing behind it? The SOPs, the logbooks, the batch records, all of it working together to guarantee that what's inside is safe. It's the secret life of a vaccine, hidden in plain sight.